So we're seeing a lot of patients with chronic pancreatitis, and we're worried about this diagnosis of exocrine pancreatic insufficiency, EPI. How do we make that diagnosis?
That's a very good question. Depending in the spectrum where the patient is and how advanced the disease is, how much damage there is in the gland, you may have early symptoms or the full-blown symptoms of fat in the stool, weight loss, malnutrition, and so. The questions that I always ask the patients when I'm seeing them in clinic early in the diagnosis, it's, are you having the clinical symptoms of, are you getting bloated? Are you, when you eat, are you having, how many bowel movements are you having? Are they soft? Are they well-formed? All of these indirect clues that may give you an idea that may be malabsorption. It's very, very important to keep in mind that it may be other conditions that are giving the same symptoms. So having the symptoms doesn't truly mean that they have exocrine insufficiency. There's some other tests that may be a little bit more direct and more specific for the diagnosis, like stool collections. In the past, we used to collect the stool for 72 hours, measure the amount of fat that it was in there. That's something that most of us have been staying away from and that we no longer do, unless we're doing some clinical studies or research-related studies. The new tests, the ones that we have been using more and more, it's an antibody that we can measure in the stool to get an indirect idea of how good the pancreas is working. And frequently I'm asked, why in the stool if you're looking for the pancreas? But again, everything that it's made in the pancreas, it's going into the small bowel colon and it ends up coming in the stool. So that's why we measure this antibody. This antibody that it's looking for the specific elastase, actually, so we can measure the levels, will give us a very good idea in what shape your pancreas is and if you may need or not treatment.
And that's a great point. That's available widely, that test. Yeah. There's other centers where we actually stimulate the pancreas directly with certain products that we can measure to make sure the pancreas is functioning. So that's something that can be done as well. The difference between that is that it's more of an indirect test to look at what's in the stool as opposed to directly stimulating the pancreas where we can look and see if it's actually functioning and making what it should. I think it's also really important for people to recognize that sometimes that fecal elastase test, which you talked about, or the direct stimulation of the pancreas, that only becomes abnormal way down the line as far as patients getting fairly significant exocrine insufficiency. So it's really important if we suspect that a patient has exocrine insufficiency or is at risk for it, they may not have developed as severe disease as potentially will show up on these tests, that they get treated early. If it's suspected that you have exocrine pancreatic insufficiency, it's very important that patients undergo appropriate treatment.
I totally agree, and I think that it's important to know that it's a disease that may not progress depending on what's triggering the disease or the progression of the disease, and it's a problem that you need to ask in every visit that you're seeing the patient. Today may be completely normal. You don't know what's going to happen in a year or two, so it's important to keep it in mind and ask every time you see the patient in the office.
I agree completely.